Welcome to Guelph General Hospital. This is where you will be coming to have your baby if you've planned a hospital birth. I will be giving you a quick prenatal tour so that you feel more comfortable and prepared when you arrive. At Guelph General Hospital, you will be cared for by a supportive team of professionals. Our team consists of obstetricians, midwives, nurses, anesthetists, family doctors, pediatricians, a nurse practitioner, a lactation consultant, clerical, and support staff who all work together to provide you, your baby, and your supports with the best care possible. If you arrive between the hours of 8:30 p.m. and 6 a.m., you'll need to come through the emergency department and let the security guards know why you are here. From there, you can proceed to the 6th floor. The birthing unit triage is located on the 6th floor across from the elevators. For security purposes, all of our units are locked. When you arrive, please pick up the phone and tell the nurse why you're here. Why would you come to the birthing unit triage? Your primary care provider may be an obstetrician, a midwife, or a family physician. They may have special instructions about going to the hospital just for you, depending on who you have been following prenatally. If you are 20 weeks pregnant or further along, you should come to the birthing unit's triage if you have been contracting every 5 minutes for 1 hour, your contractions are strong enough that you are finding it difficult to talk or walk when you're having a contraction, or if you're having to breathe through them. If you think that your water may have broken, if you are bleeding, if you notice a change or a decrease in your baby's movements, your baby should move 6 times in 2 hours, or if your healthcare provider has advised you to come into the hospital. If you are less than 20 weeks pregnant, you will be seen in the emergency department. If you have been involved in a car accident, fallen, or have been injured, you should go to the emergency department and an obstetrical care provider will see you there. Your nurse or midwife will gather information as to why you've come. You might believe that you're in labor or have a concern about your health or your baby's health. Please be sure to let them know if you do have any special considerations in pregnancy, such as high blood pressure or diabetes. From here, you'll be taken to a curtained area where you can have one support person accompany you, and you'll be assessed there. You may be wondering what to bring to hospital when you're ready to have your baby. Things to bring include your provincial health card, any additional insurance information, any medications you are taking at home, a pen or a pencil, anything you need to occupy yourself or to relax you during labor or while you wait. There is a coffee and snack shop available in the hospital for your partner or support person, but feel free to bring snacks in for them, as well as for yourself for after you give birth. Pillows from home to keep you comfy while you are in labor, underwear and sanitary pads, comfortable clothing for yourself for after you've delivered, newborn-sized diapers and wipes or washcloths, baby clothes for when your baby is not skin to skin, as well as some receiving blankets, a car seat that is 5 years old or newer, toiletries such as shampoo and soap, toothbrush and toothpaste, and money for anything else that you may need. Here's where we will assess you in triage. Some of these assessments include doing your vital signs, checking your baby's heart rate and rhythm. We may place you on the monitor. We will also check your contraction pattern, including duration and strength of the contractions. We might also check to see if your water is broken, or check your cervix to see if you are progressing in labor. If you are scheduled to have a booked C-section or a booked induction, please be advised that your healthcare provider will give you instruction ahead of time. Also, it's important to know that sometimes plans change depending on what is happening on the unit. From here, you will either be admitted into labor and delivery or as an inpatient for further care or assessment. You may also be sent home with further care and instructions and a plan. Once you're admitted, you'll come to one of our 5 labor and delivery rooms or the operating room, depending on your situation. During labor, you're able to have 2 support people with you at all times. You'll also have a dedicated one-to-one nurse or a midwife who will stay in the room with you and provide you with support, comfort, and answer all of your questions. Your nurse or midwife will be monitoring both you and your baby during the labor process. They'll let you know the mode and frequency of this monitoring. Many women are able to manage labor with simple interventions and comfort measures. However, there are pain medication options available to you as well, depending on how far you are along in labor, such as narcotics and an epidural, so please ask your healthcare team about these things. We also promote skin-to-skin contact for at least the first hour or 2 after delivery. This helps promote your baby's heart rate, regulate the temperature and blood sugar. It's a great time to bond with your baby and practice feeding. This is our operating room. It is located near our labor and delivery rooms as well as a special care nursery. If you're going to have a C-section, this is where it will be. This is our recovery room. If you've had a cesarean section, we will be bringing you here for a period of specialized monitoring and recovery. From here, you'll go to your postpartum room. Providing that all is well with you and your baby, you'll be together at all times. Babies who are born a little early or who need extra help or specialized care at birth may spend the first few hours or days of life here in our special care nursery. This can be unexpected. The nursery nurses, pediatricians, and nurse practitioner will provide you with updates on your baby's progress and answer any questions that you may have during this time. We provide a family-centered environment here and want you to participate in the care of your baby. Upon arrival to the special care nursery, you and your family will be given instructions regarding routine practices and visiting guidelines. Your nurse will also provide you with a folder with all the public health information from Healthy Babies, Healthy Children that you'll need for after delivery. This includes community resources on breastfeeding and your own care for after delivery. We also do 2 tests on the baby before discharge. The first is a hearing test, and the second is a heel prick test. While we perform this heel prick test, it can be painful, so we like to use comfort measures such as skin to skin, breastfeeding, or the administration of sucrose during the procedure. Before your discharge home, we'll provide you with information on registering your baby with Service Ontario so that you can complete the birth certificate and social insurance number, and we'll give you the temporary health card for when you go home as well. Visiting hours here at Guelph General are open, but we recommend keeping visits here short or saving some visits for home, as you'll need the time to rest and get to learn and know your baby. We want you to be comfortable while you are here, so please ask your team members any questions that you have. At Guelph General Hospital, we celebrate the birth of every child with a chime heard throughout the hospital. It is our privilege to be part of this special occasion in your life. Everybody's birth experience is different. We want yours to be the best and safest possible.